What is asthma? Asthma is a chronic inflammatory condition of the airways, in which the airways narrow easily in response to a wide range of stimuli. Symptoms of asthma: coughing, wheezing, chest tightness, short of breath. The aims of management are: first, to recognize asthma; second, to abolish symptoms; third, to restore normal or best possible long-term airway function; and fourth, to reduce morbidity and prevent mortality. Education of patient and family. Educate them proper use of inhaled drug or the metered dose inhaler. First, shake the inhaler. Second, hold inhaler upright and open the mouth cover. Third, exhale through mouth. Fourth, place the inhaler in your mouth between your teeth and close with mouth around it. Then, start to breathe in slowly. Press the top of inhaler and keep breathing slowly until have a full breath. Lastly, remove the inhaler. For dry powder inhaler, open your inhaler by holding it in the palm of your hand. Put the thumb of your other hand on the thumb grip and push the thumb grip until it clicks into place. Second, slide the lever away from you as far as it will go to get your medications ready. Third, breathe out away from the device. Fourth, place the mouthpiece gently in your mouth and close your lips around it, breathing deeply until you have taken a full breath. For tubular inhaler, first unscrew the cap and take it off. Hold the inhaler upright. Second, twist the colored grip of your tubular inhaler as far as it will go. Then twist it all the way back. You have done it right when you hear a click. Third, breathe out away from the device. Fourth, put the mouthpiece between your teeth and close your lips around it. Breathe in forcefully and deeply through your mouth, and then remove the tubular inhaler from your mouth before breathing out. Always check the number in the side counter window the mouthpiece to see how many doses are left.
Avoidance of precipitating factors. 1. Allergen. Example: cat, rabbit, pollen, smoke. They can induce the inflammation and allergic asthma. 2. Strong emotional expression. Example: stress, fear, and anger. 3. Avoid medication that may worsen asthma. The example of drug: NSAID, ACE inhibitor, and beta blockers. 4. Mouth breathing. Mouth breathing can lead to moderate bronchial constriction after exercise. 5. Occupational asthma. 7. Breathing technique. Asthmatic people tend to do rapid breathing. 8. Respiratory viral infection.
Assessment of severity. Assessment should be done as follows. Clinical assessment. Or by measuring peak expiratory flow. Take measurement 2 times daily. In morning and evening. First, set meter to 0. Second, stand in upright position. Third, take a deep breath and hold it. Fourth, place meter in mouth and close lips around it. Fifth, blow hard and fast into meter. And 6. Record meter reading. After taking measurement from peak flow meter, we must calculate peak expiratory flow by using this formula. During period of well-being, during symptomatic episode.
Lowest effective dose of convenient medication to minimize short and long-term side effects. The pharmacological approach to manage asthma in adult patients is generally divided into 2 classes. First is bronchodilators, second is anti-inflammatory drugs. Bronchodilators generally is decrease the resistance in respiratory airway, relax bronchi and bronchi muscles, and increase airflow to lungs, and cause bronchodilation. Example is adrenergic bronchodilators, anticholinergic and methaxanthin. Example of adrenergic bronchodilators such as short-acting beta-agonist, long-acting beta-agonist. Drug for anticholinergic is ipratropium bromide and methaxanthin is theophylline. For adrenergic bronchodilators, it acts by the stimulate adenylyl cyclase and increase the cyclic adenosine monophosphate in smooth muscle cell. Example is short-acting beta-agonists such as salbutamol for quick relief, and also the long-acting beta-agonists such as salmeterol. For anticholinergic, it acts by competitively inhibit muscarinic receptor and also prevent bronchoconstriction. For example is ipratropium bromide. For methaxanthin, is relax the smooth muscle of bronchial airway and pulmonary blood vessel. Example of methaxanthin example is the theophylline. For anti-inflammatory drugs, it prevents the asthma exacerbation and from develop and also prophylactic and maintaining drug therapy for asthma. It is divided into corticosteroid, equatorial receptor antagonist, and mast cell stabilizer. Example of corticosteroids such as beclomethasone, montelukast for LPRA, and sodium cromorgelate for mast cell stabilizer. For corticosteroid is main prophylactic, and also it reduces the inflammatory and cause hyperresponsiveness. The oral steroid also may be required for severe chronic asthma. A stepwise approach. The stepwise approach, first, patients should be start on treatment at the step most appropriate for initial severity of their condition. Treatment would then be changed according to their progress. For step 1 is mild episodic asthma. Step 2 is moderate asthma. Step 3 is severe chronic asthma. And step 4 is very severe asthma. Stepwise approach. The first step will be the reliever is nipped with short-acting beta-agonists such as salbutamol, and also consider to have a low dose of inhaled corticosteroid. The step 2 is that the low dose of inhaled corticosteroid and LPRA or low dose theophylline. For step 3, we use the SABA, short-acting beta-agonist, and long-acting beta-agonist. For step 4, we needed the short-acting beta-agonist and also the inhaled corticosteroid with high dose. And lastly is step 5, which is severe, we use the anti-immunoglobulin E, for example.